The information shared on this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking care because of something you heard on this podcast. The views and opinions expressed by guests or hosts are their own and do not necessarily reflect the official policy or position of any affiliated organizations. Reliance on any information provided by this podcast is solely at your own risk.
Welcome to the Healthy Image Podcast, where we talk all things health and wellness. Today, we are joined by Dr. Paul Guerrero, a seasoned chiropractor and the founder of MuscleWorks, Inc. He's been helping people feel and function better for over 35 years. Dr. Guerrero studied human biology at BYU and earned his doctorate in chiropractic medicine with the Dean's List honors from SCUHS. He's also trained in sports medicine, nutrition, rehabilitation, and had completed a residency in pediatric chiropractic. At MuscleWorks, Inc., he and his team focuses on natural, drug-free healing, offering spinal adjustments, massage, sports-related treatments, physical exams, and specialized supportive programs, including care for infertility. His core belief is simple: when the spine and nervous system works well, the whole body works better. Welcome, Dr. Guerrero.
Thank you very much. It's a pleasure to be here.
Welcome, Dr. Guerrero. And, thank you so much for being here. We're very excited to have met you. What inspired you to go into chiropractic medicine and in particular to study human biology first before pursuing chiropractic doctorate?
First, I've got to say that most of the influence I had was from my mother, who raised us pretty much completely on alternative therapies when we were small. When we immigrated from Argentina, she brought a book with her that was just a homespun remedy book, and that's how she kind of treated us for everything. Shortly after that, our family met one of the first people that kind of sponsored us over, and his name was Dr. Tanner, and he treated us for everything under the sun, and later found out that he was a chiropractor. So early on, I must have been 5 or 6, that was what I wanted to do. So those two people were my impetus.
Wow, that's amazing. I kind of can relate in some ways. My mother also used like plants and herbs to, treat us when we had a cold or a flu. So she looked at more holistic practices too as we were growing up. So that's wonderful. And then over 25 years of practice, how was your philosophy of holistic root cause care evolved, especially as you began to integrate sports medicine, pediatrics, and nutrition?
Well, mostly when I started out, there was there was some antagonism between medical people and chiropractors. And so over the years, we have seen that improve. So we have more doctors, medical doctors referring to us for all kinds of things, mostly musculoskeletal stuff. But also, in the last probably 25 years, alternative methods have really come to the forefront. And, for those in the chiropractic profession, it's nothing new. We've been doing this for over 125 years. And in terms of a holistic doctor, you see all kinds of people coming out with certificates about holistic this and holistic that. And we were pretty much the first ones on the block to do that. So for us, it's just been a natural progression to see this kind of push towards natural alternatives to the forefront, which certainly makes practice now a whole lot easier to do because more people are looking for it.
Yes, especially with root cause medicine, that tends to be a hot topic lately, especially, that also being in alignment with functional medicine too. People really want to know when it comes to prevention or even chronic illnesses, if you will, that, what can I do besides taking, these prescribed medications? Is there something else I can do? Is there something else that, I can use to help myself to get better? Because I don't want to continue, taking these prescribed medications. Is there a way that I can come off of them? I think those are many, many questions that many of us ask ourselves, and that's more of, I think, it has to do a lot with root cause. why does this person have this? And, what can we do? Is there outside practices or outside variables that may be in our control in order to, help myself have, more quality wellness?
I think in this country we've been pretty much educated to think that the only kind of health care you get is what someone else gives you, namely a drug. You have some symptoms, you go get something from the doctor, and the symptoms go away. We now know that that's kind of a poor way to practice. It's kind of symptom management instead of curative kinds of methods. And so more people now realize that there are other options that are healthier, that are better. I will say that the treatment times where someone's going to feel better from an alternative method is going to be a little longer than someone's going to feel better taking a drug, because those things work in 15 minutes. So, but an overall cure, a better sense of well-being, certainly there are far more options that are healthier for people now than there's ever been.
Absolutely, especially looking at nutrition too, and starting with what can we do instead of in terms of lifestyle choices too. I think. Can you describe a case or two where traditional medicine, such as drugs and surgery, was avoidable thanks to chiropractic care and natural therapies?
Oh boy, where to start? I mean, there's a lot of people that certainly benefit from the alternative side of healthcare. One of the easiest examples to illustrate, though, are people who are in the diabetic range. Diabetes in this country is rampant now.
Yes.
And we're now seeing diabetes in kids that are 12 and 10 and 9, where we never saw that before. So certainly that kind of thing responds real well to alternative therapies, especially nutritional. Not just supplemental therapies, but lifestyle changes are a big one. People just realize, now they're realizing that it's not just a medicine that can help lower their blood sugar. Now it's an evening walk for 30 minutes.
Oh, yes.
It's leaving, the table maybe half full, right? But it is certainly a dietary change that we always ask people to do. A little less on the carbs, a little less on the sugar, a little more on the proteins. So once they understand this, that a type 2 diabetic doesn't have to live like that, that it can actually be fixed, it just brings people in droves to find an answer other than 3 or 4 or 5 medications on top of each other.
Oh, I hear you. Some time ago, we had a doctor, one of our own radiologists. He was talking about musculoskeletal health and how weightlifting is important, and how weightlifting also helps with, the glucose absorption when we have, a high blood glucose level. And when you're lifting weights, that can actually increase, becoming like a glucose sponge, if you will, when you have more muscle, when you're lifting heavy weights. And I've been, listening to other podcasts, and other physicians also talk about that as well. And it's very interesting because that's not something I've heard of in the past.
Exercise is one of the things that's probably easiest to change in someone who is diabetic. Start them exercising, and you see that blood sugar drop within certainly a week.
Wow.
But the body has an amazing resilience to it, and once you understand how to work it, then you can make all kinds of changes more rapidly than people think. Right? So it's a very, that's probably the easiest example to give you in terms of someone who chooses an alternative therapy rather than metformin or something else that they can give you. We suggest strongly people change their lifestyles, because now it's not more, I should say it's more personalized, where people now are made to be responsible for themselves. Instead of just depending on a medical person, whatever they may be, to tell you, here's the drug you take and this is what you're going to need, and that's going to be in your life forever.
Yes, and at the same time, we live with ourselves all the time, right? We are the only ones who are with us 24 hours a day. And so we cannot rely on this doctor who we see, who knows how, how often we see the doctor.
Maybe once every 3 months,
Exactly.
once every 6.
Exactly. And then if we see them only 15 minutes or 20 minutes at most.
And he's got to remember you from the 200 patients he sees in
Yes.
a day or two.
Exactly.
And he doesn't know what your case is when he sees. He's got to look at his chart and say, what did I do to this person last time?
Yes. And I think, doing what you can, if you are in that position where you want to change your health or just develop more healthy lifestyle choices and healthy habits, starting with baby steps, starting what you can do. Because if you look at the big picture and you say,
Right.
I want to lose 50 pounds and then I want to do that by next month, that's impossible.
Right.
So I think that starting with just baby steps, what is it that you can do today? And then focus on the daily.
We
you
get
can
a lot of
change.
people about this time of year, certainly around Thanksgiving, right?
Oh, yes.
And so the family's coming together. They haven't seen each other in a while, and now they want to get down from size 12 to size 8, and they want to do it in 2 weeks. Or the Christmas is coming, and the holidays, you got to fit into that dress. Doing things like that is not real healthy.
It's
right?
not very sustainable either.
Correct. You can't keep it going. So a lot of people come to us and they say just that. I got my 40th high school reunion coming, and I got to fit how I looked in high school, and they're now, 50. Come on. There are things that you have to put in place, and they are baby steps, because you can't make that kind of change that quickly. And people have to understand there's going to be some time involved in these things. So again, we see a lot of people who are just jamming with Ozempic right now. I mean, they're coming in and they got that thing going, and it's a shot, it's quick, and they're losing weight like crazy. But there are problems with that, right? We might be able to talk about that in a minute, but people want to get into the weeds on some of these healthcare ideas because they want to improve quickly, or they want to lose weight quickly, and most of the time, it doesn't work that way, right?
Yes. Well, very good.
Well, let me ask you, what role does nutrition play in your holistic plans, and how often do you integrate dietary or lifestyle guidance along with spinal or structure work?
Oh, it's huge. Every patient that comes into the clinic gets some sort of nutritional guidance, either with their lifestyle choices or dietary choices at home, or with something that we have in the clinic that we supply them, a supplement of some kind. Now, the big item that is just rolling around the country is the peptides. I mean, people coming in, bringing their peptides in and say, can I take these? And so, we have done what medicine always does. They take something that starts to be good and they chop it to little tiny pieces, and then they make businesses out of all those. And so, peptides are just little pieces of amino acids that were all at one time put together. So now you have one that does just soft tissue healing. Now you have another one that does, removal of lung scars. I mean, there's a whole kinds of these things. And so most people that come to us, whether it's a sports injury or whether it's an internal problem, they're always going to get something like that, because there are things that will speed healing along. And so everybody gets it.
Oh, wow.
Everybody gets it.
Wow, that's amazing. That's an interesting topic, actually. Peptides are currently trending right now in many podcasts. I wanted to ask you about BPC 157. I know that's one that has been discussed recently in various channels.
Yes, the Wolverine enzyme.
The Wolverine stack.
Peptide,
yes.
Yeah. And it's by itself, it's fine. It does speed healing along, right? And a lot of different practitioners are using it. I talked to a plastic surgeon just this week. He uses it after he does his facial surgeries. His patients get them, and they use them, and they help. What we see now are people stacking more than 3 or 4.
Wow.
Which we don't know how that's going to work in 5 years.
There's not enough
Right?
research on there.
They're so new, and like everything new, people jump on it, and because it's a peptide, it's not really going to hurt you, we think, but we don't know. We don't know how a stack of 4 or 5 or 6 of these things is going to impact your health in the next few years.
Yes, I've also heard of NAD as well.
Yeah.
Sub-Q, how that's helping lots of people
and
too.
There's some great things like that are safe, they are effective, and again, just to reiterate, these kinds of things are really beneficial, but they work more slowly than a pharmaceutical is going to work. And so a lot of people think, well, I'm taking a pill, it's a supplement, it's going to work just like that. No, there's going to be some time involved, right?
Absolutely.
So, but yes, there's a lot of things in the nutritional world now that a lot of practitioners are using. And the amazing thing to me is that after 35 years of practice, I'm starting to see a lot of what people used to call us quacks about, they are now using. And so, as I mentioned Dr. Tanner early, when I was like 4 or 5, this was like back in 1963, he was using nutritional supplements. And I remember people just saying how irresponsible that was, how useless that was, how that was very dangerous to do. And we were talking vitamins and minerals back then.
Wow.
And so, but now we know a whole lot more. And now what used to be quackery is now top shelf. So, I've seen that over the last 35 years. And it works. It's always worked. But as I said, there's always been a little battle between what's a pharmaceutical, what's a nutraceutical, and how much money can you make off either one.
Oh, yeah. And I also see probiotics being used a lot, too. But I'm also seeing more and more how people are making their own fermented food from home.
Right.
And how that has great benefits when it comes to like gut repair.
Yes.
And then just the entire microbiome system.
Yes.
Which I've also, jumped on the bandwagon and learned how to ferment my own food and make my own sauerkraut and all. But I've noticed just personally how I feel. But it does take time to see and feel those benefits.
Yeah, I mean, I've talked to many, many women over the course of the last, let's say just 2 years even, who have started baking their own sourdough bread.
Yes.
Right? It's a big thing now, too.
It is.
You got to, here's your starter, and don't mess it up, and here's how you do it. And you can see a zillion videos on YouTube on how to bake sourdough bread. But not just that. It's that whole microbiome in the gut because, we've known for generations that the nervous system has a big role in the gut biome, and it connects with the brain.
And the
and
vagus
so there's
nerve,
a ton of information that the alternative side has always known. And so when you can treat those things naturally, again, people are fermenting their own cabbage.
Yeah.
They're making their own kimchi.
Kimchi's
They're-
the best.
they're-
Yes, kimchi's
right?
delicious. Their own beets too,
They're fermenting everything.
Yeah.
That's amazing.
And, I don't know how long ago, maybe 10 years, 15, 20 years ago, kombucha started making their teas that were fermented, right?
Yeah.
And so that's just another portion of an alternative lifestyle that is beneficial for your health.
Yeah, I mean, we can talk about a lot about, food that's fermented. I think that's a whole topic all on its own. But, just to add a point to this, fermented food has been around for centuries before refrigeration because we didn't have refrigeration back then. And with these, microscopic, these bacteria that live, these bugs that live in that food, the bacteria, we've evolved with them. And so we very much need them to survive.
Yeah. And
They're very essential.
that spills over into the whole microbiology kind of field because, again, we've been educated in this country to fear a bacteria.
With your background in sports medicine, how do you approach injuries or pain related to athletics differently than typical chiropractic care? Are there specific strategies, preventative methods that you emphasize for athletes or highly active people?
That's a good question, but the answer is very short. There really is no difference. For example, an injury is an injury. You sprain an ankle running in a 100-yard dash, for example. It isn't any different than a sprained ankle that you get falling off a ladder at your house. An injury is an injury. The only difference is in our clinic is that because we do see a lot of elite athletes and their careers depend on their athletic ability. So a lot of kids that are on scholarship at D1 schools, if they don't play, their scholarship goes to the next guy down. So in the professional levels, it's the same. If they don't play, they're losing a lot of money per game. So our therapies are only different for them as the general public in the speed or the aggression at which we fix it. So somebody who's at a collegiate level, we really get aggressive with these people, and because they can't really waste 2 weeks or 3 sitting out.
Absolutely.
Whereas someone like, myself, who doesn't do anything like that, if I get injured, I can afford to take a month and heal, where these people can't. So that's the only difference in us in terms of treating an injury that's athletic and one that isn't.
Okay, well, very good. And how common is it for spinal alignment or nerve interference versus soft tissue or joint injury to masquerade as typical sports injuries? An example, knee pain, shoulder pain, chronic tightness.
Yeah. Well, the spine houses the central nervous system, your cord, right? And that connects up into your brain. So everything in your body is communicated through that center, right? So the speed at which your muscles turn on and off is controlled by the nervous system. The heart rate, the rate at which you breathe, everything, how fast you blink, is controlled by the central nervous system. And so as chiropractors, the old explanation was that we simply remove the interference on those areas that are interfered with, and then the electrical flow runs more normally, and the body runs more naturally, like it should. We do a lot of manipulation to the athletes because as that nervous energy flows more normally and naturally, then coordination goes up, muscular speed goes up. There's no real lag between a white twitch turning on and a red twitch turning off, so that the body stays as balanced as it's supposed to be. So that's how we incorporate the chiropractic side into, sports management or even daily living. What mom doesn't want to, at the end of the day, right? She's lifted her baby out of her van 5 or 6 times. And those little babies can range anywhere from, 5 or 6 pounds to as 25 pounds. And so, that mom is going to have some back pain.
Yeah.
That an adjustment to that whole area, the hips, the back, is just going to make her feel a whole lot better.
Many people view chiropractors as primarily back pain or neck pain specialists. How would you like the public's understandings of chiropractors to evolve? What are some underappreciated benefits that some people should know about?
Well, first of all, we need to re-educate people on what chiropractors are, right? Mm-hmm. So in this state, we are licensed physicians that can examine, diagnose, and treat anything. The only thing we can't do in California is puncture the skin. We can't give a shot, nor can we deliver a baby. But short of that, we can do. So most people do, unfortunately, think that we are only neck and back guys, right? But that's been an education that has been handed down to us from other areas of medicine that wants to pigeonhole us. So most, for example, in all 50 states, it is licensed and registered, and certain states have different scopes. In California, we can't practice OB, GYN, we can't do that here. But in Washington and Oregon, we can.
Oh.
So I have classmates that live in those states, and they practice obstetrics and gynecology, and they deliver babies every day.
Wow.
So the amount of information or knowledge or scope that we have is pretty broad. But again, people have only heard about us because we just, you have a headache, you go to the chiro, you have back pain, you go to the chiro. Mm-hmm. But they need to understand that there is far, far, far more than we do than most people realize.
Yes. And I think also, correct me if I'm wrong, in Washington and Oregon, you're able to do shots or prescribe. Yes, exactly.
Correct. In Florida, we can prescribe drugs, but not in California, right? California is a tough state because, it's a very populated state. just to give you some numbers, when I graduated 35 years ago, there were 60,000 chiros worldwide.
Wow.
That's not very many. The first place I started practice in San Diego all those years ago, there were 300 dentists in the town I was in, right? So when you look at numbers, there's very few of us. And now, 35 years later, there's even less. There's only 25,000 throughout the world. And a good portion of that is in California.
Wow, that's amazing.
So, there's economies that work with that, right? I mean, when you look at those numbers, we should be the highest paid doctors on the planet. But there's other factors that are at play. There are lots of things that chiropractors can do. And it's not just adjusting a neck or a back.
With a growing interest in integrative and holistic medicine, how do you see chiropractic care fitting into a broader healthcare continuum?
Oh gosh, we see it now. I mean, like I said earlier, we're starting to see a lot of people now picking up on this alternative natural approach to healing. And they do know that we are the ones that kind of have been in it for a long, long time. And so there are now clinics that are holistically minded clinics that have a medical doctor, they'll have a chiropractor, they'll have a nurse practitioner, they have an acupuncturist, and they're all working together. And they cross-refer to each other. So there's more acceptance of that now than there ever used to be. I work next door to a medical doctor who's an internist. He refers people all the time to us. But the good thing about that is that he now uses the supplements that we use in our office. So he's been educated a bit by us. So now he has them in his place, and he refers to us, we refer to him. So the relationships are a lot better, so that it gives more people a better view of the holistic side of healthcare. And certainly a lot more medical doctors are now using it and referring to it. And so it just goes up from here, right? People are real anxious for it because they've learned that over the years their health conditions have not improved with medications alone. They've been managed, but that's a whole different thing than being cured.
Oh, yes, especially with chronic illnesses. I think if we don't do more, if we just do the bare minimum of taking whatever the drug prescribed is, and that's all we do, the condition gets worse.
Right.
It's not truly managed in a way where the person can see a good benefit from it or a good outcome.
And I think, maybe for this environment here today, it's probably a very long subject to approach, but,
Yes.
but there are economies that play into all this healthcare. And, our view as chiropractors has always been to fix it, right? You have an issue, you can fix it. I'm of the philosophy that in our clinic is an example of it, where a lot of my classmates and a lot of chiropractors now will have you sign a contract for 35, 45 visits. And, how do they know it at the first visit that it's going to take that many, right? But they have you sign on the line. They have you pay $4,000 up front. We tend to have a different view. We see what your problem is. We try to get you educated as to what you can do. What we can fix, we fix. And then when you're done, you're out of there. It may be 4 or 5 times with us instead of 40. So that's how we look at it. Your body can heal. It can heal itself. Sometimes it needs a little help. But it's not anything that should be chronic, because that's what we're the best at, is tackling the chronic problems that people just drag with forever.
Oh, yes, I agree with you. It is a big topic, a big subject to cover. What is your take on the role of advanced imaging like MRIs, CT scans, X-rays, in chiropractic care? When do you recommend imaging, and how do you decide when a patient would benefit from, structural spinal evaluation rather than relying solely on imaging?
Right. Well, for us as chiros, we really have kind of grown up with X-ray. we get 400 hours of it in school, right? Beyond that, if we choose to, there's a residency program that is another 4 years just in radiology. And just as a side note, chiropractic has a number of different residency programs that we can choose. There are chiropractic radiologists where all they do is sit in a dark room and read scans, right? And that's a big bite to chew off of when you're a student, because once you graduate, you've spent 4 years in school, and now you're going to spend another 4 full time doing radiology, right? But so we have, there's radiology, there's neurology, there's sports medicine, there's orthopedics, there's nutrition, there's all kinds of stuff that we can get into as a post-grad that we can specialize in. But so the point being is we get a lot of it in school, a lot of it. Most schools in the country go from 300 to 400 hours of it in the 3 or 4 years that they're educated. So we're trained that way. Now, when I was getting out of school, the big push was you got to get your X-ray machine in your center, and because that's a revenue generator. And that's probably smart business, but it didn't fit with my philosophy of healthcare, right? Am I going to X-ray everybody that comes in? No, because they don't need it, right? But the people that do, for example, in our case, trauma, if there's any kind of trauma, we're shooting them, right? Fractures can hide. There's lots of reasons to shoot an X-ray of somebody. But because we do more than just skeletal radiology, we do a lot of MRI. I have a partner that we send over a ton of MRI, ton of imaging. And because we're now hooked up with Hill, right, we can see it from our screens without having to look at a hard film. And it's so nice. It really is such a nice system for us. We can order it online. We see it within a day or two, and there it is, and it's just great. But we use imaging an awful lot. On our functional med side, we do a lot of MRI because we're looking for different things than something bony, right? So people come to us for all kinds of things, and we are very quick to use imaging when we see the need. Now, again, let's say out of 35 people that come in every day, we're probably sending out 5 or 6, right, that need imaging because they've had trauma. They've fallen off a motorcycle, or they have gotten a car crash, or whatever the trauma is. But we will do the initial intake images, and then we'll treat for maybe a month or two, and then we'll do some post-treatment images and see what changes we've made. Some people come to us that have scoliotic changes, right? And so we can see it, right? We can see it on the exam, but to get the detailed measurements of it, we shoot them to see where they are. And then we can appropriately design a treatment protocol better for them. So it fits with chiropractic, with all of chiropractic, no matter how they practice.
All right. Well, very good. Well, I'm glad to hear that. And Dr. Guerrero, how important is imaging interpretation in diagnosing root cause versus treating symptoms?
Root cause is one of those topics that people dive into real deeply, right? Mm-hmm. And I've got to say something cautionary, because a lot of people will take such a deep dive that they almost miss the mark of what they're trying to find, because there's so many things, especially with ChatGPT and all the other AI systems out here now. People come into the office and they've already diagnosed themselves, right? Here's my problem. I checked it. Chad said I got this. And they always tell you, oh, this is my root cause right here. And I'm going, okay, well, maybe, right? Maybe it is. Maybe it isn't. Most of the time it isn't, because they've gone so far off the edges that, you can really get into the weeds and find mud and not ever get out. Mm-hmm. But imaging for us, we use it to root causes are different, because we're using imaging to find we're using it to find trauma. We're using it to find malignancies. We're using it to find abnormal anatomy. That's what we're using it for, right? And so we're not using it specifically to find a root cause, because some of the root causes are cellular, and you're not going to find imaging that's going to go that deep, right? However, we do use a system. I can't remember how far down Orange County it is, but when we want a brain map of somebody who's had a number of concussions, we send them to the center and they inject them with some kind of a contrast, and then they can then image the brain in color. It's a beautiful tool that helps us to diagnose what parts of the brain are damaged, how long it's going to take to get this person back to playing, if they're going to get back at all. So that's how we use that technology. We use it to find where the big problems are. Once we can find those big problems and they get past that, then we can talk about root causes down in here, right? But for us, it's really important, and we use a lot of it.
Oh, yes, that makes sense. And do you think there are potential benefits or drawbacks to chiropractors having more formal training or privileges related to ordering and interpreting advanced imaging, especially in complex cases involving nerve or spinal issues?
No, like I said, we are very well educated in that area. We are. I mean, part of being a chiropractor in the early days was having an X-ray in your office. So it's we are all trained on how to read them. We're all trained on how to read X-rays. We're all trained on the different aspects of radiology, whether it's bony or soft tissue, organ images. We're all trained on reading MRIs. We're pretty good at it. We've been doing it for 125 years, and it's, most, if not all, chiropractors are real adequate about looking at an X-ray or an image and knowing what they're looking at, right? Which isn't to say that, there aren't mistakes made, right? I mean, we get images all the time from patients who bring a CD that aren't from Hill, right? And we'll pop it in the computer and we'll see things on there that are not on the report. And so we then will call the radiologist and have them look at it again. And many times they will go, oh, yeah, well, I missed it, sorry. And sometimes the missed part is the crucial part. And they're surprised when we can pick that out. But it's just what we do. I mean, that's just what we do. I mean, you can stick us, and just an average chiro, you can stick him in a radiology lab and he'll be able to read fine.
Well, that's wonderful. Yeah. I have one more question. With regards to root causes, we've been talking about root cause medicine. Is that the same as functional medicine?
Functional medicine is simply the name that we give the process of either treating or finding a root cause, right? So it's just one aspect of that whole term. Root causes can be cellular, they can be organic, they can be bony, they can be blood. So there's many ways to approach a root cause, right? We tend to look at it chiropractically as, a root cause is typically going to be generated or inhibited by the central nervous system, which we then treat by manipulation, adjusting, other ways. But those are the primary two. And so, so functional medicine is simply the term that is now being used. We didn't come up with it, but it's just the term that we use now when we put all the pieces of treatment together that is not pharmaceutical, right? That's what we call functional medicine. So we look at your diet, we look at your lifestyle, we look at your stress levels. We run hormone panels on just about every woman that comes into the clinic. If they're fatigued or perimenopausal or they can't have babies, we have a large section of the practice is fertility treatment. And so we do a lot of things in there that are lab-based and hormone-based that then goes into this functional practice that helps us kind of ferret down all these symptoms, and we can kind of put in different places the things that are maybe symptomatic but not necessarily real important, so we can find out what the most important piece is and work there.
Yeah, and that's so important to be able to go to the data, go to the blood work, go to the hormone panel to be able to tell them what is going on with their body.
Yeah.
Because many times, we don't get that. And sometimes we don't know what to advocate for. If I feel this way, if I'm in my late 40s and I'm feeling sluggish and I'm feeling this and I'm noticing all these changes, if I'm just told, oh, it's because, you just turned almost 50 or you're in your late 40s, this is expected. But I think medicine, there has to be more than that type of approach.
Right.
And, going through the healthcare system and just, having a 15-minute appointment, you're not going to get a lot from it. And then, the doctor's just waiting for the next patient and the next patient. It's almost like an assembly line. But I think there has to be more to it, more meaningful type of care that really focuses on that individual and what they're going through.
Yes. To kind of touch a bit about what you brought up, care should be individualized, right? And I don't mean to sound like this is going to sound, but there are large medical conglomerates that you are seen as a number, you're not seen as an individual. And in order to get to a real doctor over there, you've got to go through a number of steps. And if they consider you dangerous enough, then they move you up, right? If they don't, you're at that bottom rung and you can stay there for 6 months until someone can see you, right? So individual is extremely important because we're all different. We can all have a migraine. All of us in this room can have a migraine, and it's going to be different symptoms for each of us. Mm-hmm. And so you can't just treat them all the same way. So we do use the data. We use a lot of data, right? A woman comes in and she's perimenopausal, so we'll run a hormone panel on her. Do we think it's going to be like the ones we've seen before? It could be, but we don't assume it is. I have a big problem with some of even my colleagues who don't do any of that, and it's okay that they don't, but they will tell a patient something when they have no idea if that's actually true or not, right? We know some practitioners that they don't even touch the patient, and they just somehow know what the root cause is. They know because they've talked to them, and their psychology is such that there's a mother issue or a father issue or some other kind of psychological thing going on. And so they go, oh, we know what that is. And without even doing anything else. And then they'll place them on 5 or 10 different supplements and they just let them go. So we do use a lot of data. We use all kinds of labs. We'll run labs for just basic chemistries. We'll run labs on hormones. We'll run all kinds of things to get people so that when you know what you have and you see it, then you're better able to deal with it.
Yes, I agree. I completely agree with that. And I think it's important to, look at that individual, as you said, and see what's going on with them and how can we help them and really tailor it to them. Because as you said, not everyone is the same. We all have, different bodies and different conditions and different challenges too.
Right.
And also our environments can be different too.
All different.
And that has an effect as well. Yeah.
So Dr. Guerrero, for someone who leads a mostly sedentary lifestyle, someone that's on the desk or has limited movements or even stress and is skeptical about chiropractic, what advice would you give, and what are the initial signs that should prompt someone to consider structural or spinal evaluation?
Well, just the fact that they're sitting down all day is enough, because we know now from data, right, that a sedentary person decays about as much as a person who smokes half a pack of cigarettes a day.
Wow.
Which is a lot.
That's alarming.
It is. And so just that alone, we always recommend people who do have computer jobs and they're sitting all day to get up every half hour. You got to get up, move around, right? Just so that pressure can come off your low back. For example, the L5 disc it's supportive and it's structural, but if you're sitting down all day, 80% of your body weight is sitting right on it, right? And so, you get up and you just, you know what I'm saying? You just get up slower because that thing's been compressed for 5 hours, right? So that's just extremely important in today's kind of environment because a lot of people are doing computer work, right? From home or from an office, and they're just sedentary. That's number one, right? Number two is just the fact that now they're seated, their activity level drops. They're probably drinking a few cups of coffee a day, or they're probably having a donut or two or three, or they're eating lunch at their desk. They're not moving at all. And they're going from, let's say, a guy who's got a size, 32 waist, he's not going to be a 36 in about 3 months, Just the weight gain of that alone, which affects so many other things, right? Cardiac function, lung function, pancreatic function. We see people who are sedentary now just sliding real quickly into diabetes.
Oh, wow.
And it's just, it's because it's just what they do. They don't do much.
And when you said that the waist increases, I was reading recently a study in regards to waist circumference and how important it is to have a healthy waist circumference. But what goes into that? Is it just that the person, is it because it affects the vital organs in that area?
Not just that. It does affect the organs because they're just compressed. You're sitting down, you're bent over, right? You're flexed all day. So the muscles of the pelvis shrink. They don't shrink. They just tighten down, right? The muscles that you normally would use as you move, the glutes, the abs, they weaken. So, but apart from just the physical compression, the physical component of being seated for all those times, all those hours, you now have metabolic changes that occur. Right? Your pancreas is constantly spewing out insulin just to deal with the sugars that are now in your bloodstream that can't go anywhere. There's nowhere for them to go, right? Because there's no activity. So it's constantly being secreting insulin. We see a lot of people who are now insulin resistant, right? We call it metabolic syndrome because it's, their waist is now larger than their shoulder width, and it's a problem. So there are just metabolic issues that come from just not being mobile, and that's the bigger issue than just simply gravity sucking you down and squashing L5. There's a lot more to it.
Well, what would you recommend then for someone who does have a desk job?
Yeah.
Would you recommend them getting up every hour for 10 minutes?
Or a stand-up desk?
Yeah, we
Yeah.
suggest a stand-up desk, number one. And then, we suggest also if you get a stand-up desk to have a little step stool. Just a little step stool you have down there so you can alternate legs on that stool. That takes a whole lot of pressure off your back. But, some people can get up every half hour, walk around for 10 minutes, right? And then get back down. That would be ideal, right? So that you're not just confined there, right? You've probably flown in an airplane across the country, and you're confined in that seat for 5 hours. How do your joints feel when you stand up, right? They ache.
Yes.
They hurt. So movement is life. That's what we say. Movement's life. You got to move. You got to move. And if it's not just at work, we say you got to move when you're away from work, at home. You got to exercise. You've got to do something that moves this blood around so that your systems can clean house, remove toxins, regenerate. A whole lot of things happen that are positive when you're moving.
Yeah, I heard somewhere that if exercise was a pill, we would all get it. Yeah, that's how good it is.
it.
It's like the magic, that cures so much.
It helps so much, but again, it's something you actually have to do.
Yes.
Right? You have to do it. We talk about lifestyle changes and people eating the wrong things. Okay, you've got to stop, right? You've got to stop. It doesn't help you if you just pick up exercise, but don't change what's on your table. Right?
Oh, yeah. You can't exercise a bad diet.
You cannot, and that's absolutely true. So there are things that people must accept the responsibility for their own health. And we teach that, and more people are getting it, right? But like I said before, we've been trained not to. We've been trained to only go and see the guy who knows everything and gives you a pill and says, you're going to be fine now.
Yeah.
You can eat what you want, just make sure you take your metformin, but eat what you want, which is a problem.
But then with pills, there's so many side effects. It's like you
Yes.
trade in one thing, but you get a list of side effects that you're not even anticipating.
Right.
That's so true.
How many people do you know that are diabetic who have only one medication? Only one.
Not just one. My dad's a diabetic, and
Okay.
he has more than I can count at
Right?
this point.
That's the point. They don't ever take you off of them.
No.
Even though they stop working, they just keep adding another one, adding another one, adding another one. Who's going to live like that, right? But two is there are so many side effects of that stuff, and it's just ridiculous that they won't help you through that. They won't help you take those down and work your lifestyle and improve your health.
Yeah.
Because again, we talk about it all the time in the clinic. We talk about pain management, right? And that's a term that fits appropriately with people who have this chronic pain that doesn't ever go away. Now it's managed. It's managed. So you're still going to always have it, but now you're managed. On the lifestyle kinds of things, you're now diabetic, right? They expect you to be a diabetic the rest of your life, and they tell you that you'll be on these the rest of your life. And so, again, they're taught to manage you, not to fix you. Because once they fix you, then a whole revenue stream starts to die off, and they don't want that.
Yes, and it's unfortunate because, type 2 diabetes is on the rise. So are other chronic conditions are on the rise too. But going back to what you said about even just taking a walk after you eat, what benefits that actually has.
Right.
It has so many great benefits. And on top of that, right after you're done walking for 20 minutes or even 15 minutes, you feel so good. It really does. I have more energy after I do a walk. Even a short walk, I feel really good. And that feeling lasts for quite a while too.
And on a personal note, a few years ago, we were life was comfortable for us at home. It was just me and my wife. Our kids are gone, and we were just in a nice place. And she loves chocolate, so in the house there's always a bit of chocolate around. Well, and I normally don't, but for some reason I would just nibble on one piece of See's candy every night, right? A few months later, I'm getting ready for church, and I have 5 suits that I own. And I grabbed one, and my pants didn't fit. I'm like, and it wasn't just a little fit. It was like 4 inches where I couldn't get my pants on. So I thought, I'll just get the other one. I went through all 6. No, didn't fit any of them. So I asked my wife, hey, these suits are now about 10 or 15 years old. I think they've shrunk. And she goes, no, Paul, suits don't shrink. And she goes, I just didn't want to tell you, but I had gained 25 pounds.
Wow.
In about 3 months.
Oh, wow.
And it was alarming to me because I sell health. And I'm thinking, how is this even possible? But it snuck up. And that's what happens to us all. It just sneaks up on you, right? And I thought, oh my gosh, okay. So I just started walking. And that's the only thing I did.
Yeah.
I stopped the chocolate, but I just started walking every night. And after about three weeks, I'd lost 15. And about another 3 weeks later, I'd lost all of it.
That's
So
wonderful.
just by doing that alone.
Wow.
If I'd have done other things with that, I probably could have done it quicker. But that just is an example of what walking can do, right? And, your body's meant to move.
Yes.
And everyone can go on a little walk.
Yeah.
I mean, it's the most simple exercise. It also makes you feel good, like you said, loose. And Dr. Guerrero, how can people actually find you if they want to go see you?
Well, we do have a website. I don't know if I can say it here.
Yes, please.
Oh, okay.
Please share.
So we are at muscleworksinc.net is our website. And, we're on, and it's not that I even did it, but I have kids that did it for me. So they stuck us on Facebook and they put us on Instagram. And one of my sons manages our website. And it just, so half the time I don't even look at it. But, we're in Glendora. And it's easy to find, but they can go to the website and just check us out. And we're under MuscleWorks if they can't remember the website. But we've been at it for such a long time now that most people know who we are, where we are.
Oh, that's awesome. We'll be sure to link it in the notes for YouTube.
Thank you.
Thank you for tuning in to the Healthy Image Podcast, where we talk all things health and wellness. Please like or subscribe and share with a friend who may find this helpful. And as always, stay curious, stay engaged, and stay healthy.
Bye, everybody.
Bye.